Hello, everyone. Thank you for watching today's webinar. My name is Chelsea Sprouse. I'm a pharmacist with the Virginia Department of Health. And today we're going to be talking about the COVID-19 therapeutics, specifically the monoclonal antibodies. We will have other postings that are going to talk about the antivirals as well as some of the practical aspects with ordering and such, so stay tuned for those. And I do want to just preface this by saying that this information is the most up to date as of today, which is March the 22nd. Alrighty, so there were a couple monoclonal antibodies that were available, but the FDA has since revised their EUAs, and that's for BAM-EDI and Regencov. They deemed that these two products were not effective against Omicron, so they have said at this time not to use those products and just to hold on to them. It is possible that there might be variants in the future where these products can be used, but as of now, since Omicron is the predominant variant, they have said to hold on giving those two products. So with that being said, if you do have those products still, just hold on to those in case you need to use them in the future. There are other therapies that are available, which is Evusheld, Sotrovimab, and a relatively new one, which is the Bebtelovimab. And this is just an FYI, just for those who like more of a biochemistry type look out on things. So this is just the mechanism of action for the monoclonal antibodies. Alrighty, so the first product that we'll talk about is Evusheld. This one is for the pre-exposure prophylaxis of adults and pediatric patients 12 years of age and older, weighing at least 40 kilograms. This is not for those who are currently infected with COVID or who have had a known recent exposure. Evusheld is limited to those who have moderate to severely immunocompromised conditions. In addition, it's for those who might have not been able to mount an adequate immune response from vaccination. So with that being said, it's not a substitute for vaccination. So if you have patients who are eligible to get the vaccine, they should go ahead and do so. But Evusheld can be used for those who weren't able to mount that immune response sufficient enough from the vaccine. Alrighty, continuing on, they did announce recently that there is no waiting period for vaccination after receiving Evusheld. The guidance was pretty unclear before, but now they are saying after you receive Evusheld, once your patient is eligible to receive a vaccine, whether that's first, second, booster, what have you, they can go ahead and get that vaccine as soon as they are eligible. If you look at the opposite scenario, if someone receives a COVID vaccine, then they have to wait at least 2 weeks before getting Evusheld. And that aspect has not changed. That's been per the EUA for a while. For the dosing, it does come as two different ingredients, Tixagevimab and Silgavimab. Those each are 300 milligrams administered intramuscularly as separate consecutive injections. It was previously only 150 milligrams of each product. They have come back and changed the dosing. So they're saying that double the dose would be adequate enough. For the patients who had originally received the 150 milligrams of each product, it is recommended to go ahead and give an additional dose of 150 milligrams of each product as soon as possible to those patients so that they have the full 300 milligram dose. There was a trial, the Provent trial, that showed Evusheld is effective for about 6 months. They are not recommending at this time to do repeat dosing just because there's a lack of data and there's a lack of knowing what the predominant variant is going to be 6 months from now. For warnings and precautions, you want to make sure you monitor your patient after injection and observe them for at least an hour. There are some precautions for serious adverse events in relation to cardiovascular. We have more information on the next slide, which I'll go over. Renal impairment is unlikely and hepatic impairment is unknown. As with pregnancy and lactation, majority of the products have insufficient data since these are all relatively new products. So really there's not a whole lot of data for any of these that we're going to talk about today. For the cardiovascular serious adverse events, they were very infrequent in trial. So if you actually look at the data, only 0.6% of the participants who received Evusheld had any sort of cardiovascular event, meaning a myocardial infarction or heart failure. So since this is relatively infrequent, just take that with a grain of salt, I guess you could say. Of course, if you have those patients who you have concerns for these events, then you'll have to weigh the risks and benefits. But it is important to note that when they did the trial, the patients who had these events were patients who had already underlying cardiovascular risk factors or had a history of cardiovascular disease prior to the clinical trial. So with that being said, there's not really any clear evidence to show whether or not the Evusheld caused that or not. So I'm not going to go through this in complete detail, but this slide just shows some of the medical conditions and treatments where patients might be moderately or severely immunocompromised, or those who are unable to mount an adequate immune response from vaccination. So mostly you're looking at patients who have had any sort of organ transplant, those who take certain medications, have untreated HIV infection, and those sorts of things. Alrighty, next we're going to dive into sotrovimab. And sotrovimab is for the treatment of mild to moderate disease in adults and pediatric patients. Most of these products are going to be for 12 years and older, and 40 kilograms is the minimum weight requirement. Sotrovimab, you must have a positive COVID test result and also be at high risk for severe disease progression, meaning hospitalization or death. So with that being said, sotrovimab is not authorized for patients who are already hospitalized with severe COVID-19 or require oxygen therapy for COVID-19, or if you have a patient who is previously on oxygen, if they require an increase in flow rate because of COVID, they would not qualify for sotrovimab. And again, I'm not going to go through this in detail, but here's some patients who would be at high risk for progression of severe COVID-19, in which sotrovimab would be indicated for. So mostly you're looking at your older patients who have chronic diseases like diabetes or chronic kidney disease. There is a website published by the CDC that goes through more in-depth list of qualifying patients that you can always refer to. For sotrovimab, the dosing is pretty simple. It's 500 milligrams as a single IV infusion over 30 minutes. You must initiate it as soon as possible after a positive test result and within 7 days of symptom onset. For warnings and precautions, again, for any of the monoclonal antibodies, you do have to observe the patient for at least an hour after infusion is complete. Renal impairment is unlikely and hepatic impairment is unknown. And with this one, you will want to look out for infusion-related reactions as well. And for pregnancy and lactation, again, there's not really sufficient data that we can go off of. However, they do see that antibodies have the potential to cross the placenta, but the risk and benefits there are unknown. And next, we're going to talk about bebtelovimab, which is the newer monoclonal antibody that is out. They did see in lab testing that it does have activity against Omicron, including the newer subvariant, which is the BA.2. Similar to sotrovimab, the bebtelovimab is indicated for the treatment of mild to moderate disease in adults and pediatric patients with a positive COVID-19 test result and also at high risk for severe disease progression. Bebtelovimab is not necessarily meant to be a first-line agent. That's because they found that it was just a little bit less effective than some of the other options. So with that being said, they are saying that this product should only be used really when there's not any other alternative treatment options available. So if for some reason any of the other products go on back order or are not available, then you can go to using the bebtelovimab. The bebtelovimab is a little bit more convenient to administer as well. It's a single IV infusion over 30 seconds versus the sotrovimab was over 30 minutes. It's given as soon as possible after a positive test result and within 7 days of symptom onset. Again, not authorized for hospitalized patients with severe COVID or requiring oxygen therapy or an increase in oxygen flow rate because of COVID. Now, both of the two monoclonal antibodies I just talked about, sotrovimab and the bebtelovimab, do run the risk of these infusion-related reactions, which I alluded to earlier. These are pretty rare, but they are potentially life-threatening, and these are some of the things that you'll want to observe your patient for. So fever, chills, weakness, difficulty breathing, hypotension, and those sort of things. So in the case that you do have any of these, you'll just have to be able to monitor and treat the patient as appropriate. And again, it is required to monitor your patient for 1 hour after completion. So with that being said, in the unlikely event that your patient does have any of these reactions, if your facility is administering any of these products, you do have to have the ability to have immediate access to medications to treat severe infusion reactions, such as anaphylaxis, so having epinephrine on hand, for example. And you also have to have the ability to activate EMS. And that is it for the COVID-19 therapeutic options. This slide here just shows the 2 email addresses where you can reach our team at. So the top one, which is our therapeutic specific email box. So if you are interested in becoming a provider, or if you have any kind of general therapeutics questions, feel free to email that box. We have another email, which is general questions, which is the COVID pharmacy support email box, and that's just for general questions about COVID, all things COVID. And thank you so much for your time. I hope you enjoyed today's webinar.